Once again, I want to point you out to the TA and peer learning. If you click on the TA and peer learning, it'll take you to this page, which unfortunately you do not have access to some of the opportunities that are presented here, but you have access to the resources that are going to be developed from these sections. So our peer learning communities and communities of practice office hours are only for the COEs under the capacity grant. So, but if you hover over the TA and peer learning, there's a few resources that I'd like to point you to, which there are four main ones, which is going to be the community of practice, the office hours, toolkits, and memos and case studies. So first, we'll look over communities of practice. And in communities of practice, I hope you're able to jump in and look at the all of the amazing resources that's available. So these are all of the recordings that we have so far. And just wanted to point this out. At the very bottom, it says previous communities of practice. There is more information, so you might not be able to tell, but if you click on it, it'll drop down more resources. And so you're free to look at these and reference these as well. However, I'd still like you to focus on some of the recordings starting from the top here, because these recordings are going to be giving you the most recent information. So two that I'd like to just quickly off the top of my head point out is our February 2025 about blending and braiding funds. And so this one is a really good one if your LEA is doing specialty mental health services to strengthen school-based behavioral health. The next one that is really helpful is going to be our February 2026 from Ventura County Office of Education. And they've done a lot of work. And so they collected student health insurance information. So this is something that every LEA will have to do when implementing CYBHI. So this is also a great one to look over and read. All right. So this is this section. The next one I'm going to point out is the office hours. Office hours is, there's only two videos on here at the moment, but where I'd like to point you next to is the highlights. So if you click on the highlights, it will show snippets of videos that are good to review and go over. And if you look, we have the documentation toolkits. So from today's meeting, presentation, there's another video presentation that you can also reference along with after this presentation. You can take a look at as well. So the other place I'd like to point you to is if you go to the main page, there's more videos that you can take a look at that'll provide more information that could be useful for you to take over and look at and just view as a resource. So everything on this YouTube is all publicly accessible, meaning that anyone can access these videos and resources. So that's where we'd like to point you to. Next one is the toolkits. Currently, there are two toolkits on this website, which is the crosswalk toolkit, which we'll be going over in June. So hopefully we'll see you all back in June for the crosswalk toolkit overview, and the HIPAA FERPA toolkit, which hopefully you all have access to as well. It's from Cal HHS. And then lastly, we have the memos and case studies. So this is a great resource that will hopefully walk you through some of the storytelling, some of the case studies that has been done, and provide some useful information for you all as well. The most recent one that came out was our Anaheim Elementary School District. And so this one is also a very important one. And as it goes over how workforce, and so wellness coach, certified wellness coaches and people personnel counselors. So this one will be a very useful one for you all. And so just very quickly, I wanted to do a quick activity. So if we can, at the bottom of your screen, you should have a little pencil. And in that pencil, if you click on it, it should have a taskbar where you'll see a few things, but we want to use the stamp function, which is a check mark. So if you click on the check mark, you can have hopefully a star or a heart for ones that we can use. And we're going to be using that function now for myself. But let's see, I'm going to go to the memo and we'll just run through page 9. All right. I'm going to go through page 9. And if you all can just take a quick look over this process, this is, let's see, this is the infographic of the claim process. And so if you're doing this already, I just wanted to see if you all can take a look over the this claim process and just mark with your annotations whichever one that you feel is the most challenging or difficult for your LEA right now. So if you can go ahead and mark in whichever one you feel is one of the most challenging for your LEA. So step 1, identify student needs. Step 2, identify students who may benefit from additional support and assign a provider. Step 3, provider develops a behavior action plan. And step 4, provider documents services and ordering, referring, prescribing, provider approves services for billing. So you can go ahead and mark any one that you feel is most challenging to you. So I see lots right now at 2 and 4, which is 2, identify steps, students who may benefit from additional support and assign a provider, and 4, provider documents services and ordering, referring, prescribing, provider approves services for billing. All right. Thank you all for putting in some stars. Give a couple more seconds if anyone else is trying to figure out the functions. Once again, there's a little pencil at the bottom of your screen. You can click that and the annotation should show up. And you can use the stamp function, which is the check mark, and you can mark anything on the screen. All right. Lastly, we'll close this. Oh, see some more stars. Nice. All right. Gives us a good sense for where everyone else is at and where the challenges and barriers might be. Okay. All right. One other thing that is important that I want you to bring us to is just when you have time, if you read this, there's takeaways and recommendations, which I found to be very helpful as well. So when you do have some time to go over it, I do encourage you all to read over um, this memo. All right. If you can all go ahead and X out of your annotations so we can move along with the rest of the presentation. At this time, I'm going to be turning the time over to Patrick and Amanda. We have Patrick, who is a coordinator at Sacramento County Office of Education, who is a great leader and has supported the development of this toolkit, and also Amanda Pantaleon, who's the expert or an expert from Mendocino County Office of Education and has been an amazing problem solver that has also put a lot of work into developing this toolkit. So at this point, I'm going to turn the time over to Amanda and Patrick.
Great. Thanks so much, Chi. Next slide, please. So I'll do a little bit of framing about the toolkit itself, but really, I mean, like I put on the slide, huge shout out to Amanda because I think she put in the vast majority of the work into developing this toolkit, and then we just kind of took it and then just tried to make it something, try to make it into like a document that was a little easily accessible. Um, so, I mean, this document really came out of hearing from DHCS over and over again around like the fee schedule of kind of pointing us back to the different organizations and boards that oversee the different service providers under the fee schedule, saying like DHCS saying like, we're not going to give explicit documentation guidance, go back to them. And so Amanda and I were meeting and we're like, well, we probably could go seek out all those things ourselves and start to put it all in one document. So that's kind of where this document was birthed out of. Next slide, please. So just to be explicit, none of this is direct guidance from us. We really did just try to source all this information from other folks out there and then just put it all in one easy to locate area. It'll be a living document as well, so you'll probably notice pretty quickly that there's some service providers we don't actually have a lot or really any information for. We really were focused on like the service providers that we've kind of heard the most in our space with our 58 counties that we're engaged in. So we're really focusing on like the licensed roles. We're focusing in on PPS school counselors. Um, but there's some of the service provider types that I don't think have been billed a whole lot out there. But maybe, if you're one of those LEAs out there that are starting to bill in that section, please feel free to reach out to us and say like, hey, we actually have resources underneath this service provider that isn't really talked about in the documentation toolkit, and we can update that. And you'll see if you keep checking our website, you'll see updates occasionally. Next slide, please. So to really kind of ground folks, and maybe like if you're at an LEA that is new to this work, although if you're in cohorts 1, 2, or 3, maybe you're not super new, but maybe the documentation piece is a newer piece for you, to really uplift the importance of documentation. So really helping folks understand that there's an important accountability piece. So really proving that you're meeting the criteria for billed services as well as meeting all the standards of care. Liability is a really big one. I'm thinking when Amanda and I were developing this, it's just we were thinking a lot about like the importance of really documenting clearly around crisis situations because there's a real potential concern for liability if there's not clear documented steps laid out. And I think this is also, especially crucial for the roles, the service providers that maybe aren't as used to documenting, like CWCs, certified wellness coaches. They are maybe pretty new to the field and might not always think about this piece. So just really making sure you're being explicit when you're onboarding those certified wellness coaches around like this crisis situation. Like here's what needs to be documented. Here's the pieces that around like referring out and things like that that need to be put in the record to some degree. And of course, data-driven advocacy, like really recognizing that like when you document really clearly and strongly, then it's a lot easier for you to maybe go and advocate with your superintendent or go and advocate with outside stakeholders when you have like data that you can back up saying like this is how many students we served, this is how frequently we're serving them, things like that can really help. And then of course continuity of care, which is really big in the behavioral health world of really understanding that like when students aren't always going to stay with you necessarily for receiving services. So when they go out to maybe go see like a private practice therapist or a therapist like Kaiser or Sutter or wherever, having strong documentation practices can support when you make that transition over. And you have providers who leave, right? Who quit or move on to a different job, and then there's maybe a new provider working with that student. It's really important to have clear and concise documentation to support with that transition. And of course, there's always that analogy: if it isn't written down, it didn't happen. Like that's such a truism in the documentation world. Next slide, please. Cool. I think I got this from Amanda, which I really loved. But write every note as if it'll one day be read out loud in the courtroom, but with the heart of someone who wants the best for the child. Yeah, just a really beautiful intention around documentation. It's both incredibly important for the liability reason, but it's also important to never forget the heart of why we're all doing this work. Next slide, please. So just a real brief primer on the toolkit. So we have a whole introduction. So just want to really emphasize to you as you're diving into this to read that introduction. We really took time to write out that introduction to hopefully help folks navigate this no matter where you're at in your journey around documentation. So if you're brand new to thinking about this world, we really tried to write it with that lens. And then if you've been in this world for a while as well, I think it's still helpful to read through that to just get an understanding of how we're thinking about this toolkit. And then the table of contents, if you click each one of those service providers, it'll jump you to the place you need to be to look at that service provider. So that's a great place to go to help you navigate this pretty big document. Next slide, please. So as we were developing this, there was a couple pieces I was like, man, I feel like folks out there aren't always thinking about this piece, at least within like the community we're most frequently engaged in with the county offices. So one of the big questions a lot of county offices had when we were developing this back in November was like, oh, is a notice to clients required in the school setting? And so we did a lot of follow-up with BBS, the Board of Behavioral Sciences, and really they confirmed that it is ultimately still needed in a school setting. And even though this is ultimately on the clinician to really be ensure that this is being provided, it is something that's required in a school setting for all service providers that are overseen by the Board of Behavioral Sciences. So like licensed marriage and family therapists, licensed clinical social workers, even the associate marriage and family therapist, associate clinical social workers. So there's a whole list of folks that are overseen by the BBS. But if you are, hiring those folks, it's just good to know that the notice to clients is a requirement from their board. And then the BBS requires that providers they oversee maintain records for 7 years after the client turns 18, which is different than the CYBHI fee schedule requirement of 10 years. So that's also just an important piece to be mindful of. And then one of the pieces out there that I think a lot of folks have been engaging in is like, how do we support our PPS school counselors in documentation? I know that's been a bit of a struggle sometimes. Um, so we tried to link as many resources as we could find. We've been meeting with California Association of School Counselors regularly to continue to try to co-develop resources to add to this. But we linked whatever documents we could find in this area to support that piece. And I know CASC also does their own trainings around the fee schedule for PPS school counselors. So if you're interested in doing one of those trainings, I've heard they're really great from folks that have partnered with them. Um, Next slide, please. Okay, I think I'll hand it off to you, Amanda.
Awesome. Thank you, Patrick. To you, I don't know if you have the slides on your end that you can pull up, or if not, I can share them. Okay, perfect. If we can make that a little bit bigger. If not, I can always share mine. So my name is Amanda Fonteleone. I am a LMFT and a CYBHI clinician here in Mendocino County Office of Ed. I see a few of my alma mater people and connections on here. So go Gales if you went to St. Mary's. I'm just going to put that shout out there. But my name is, again, Amanda, and I am in my experience up to this point of working in the COE, one of my primary roles was doing documentation training for all of our licensed and non-clinical staff that we had in specialty mental health. And so that includes writing and documentation under grants, writing and documentation under Medi-Cal or other insurances. I also have a private practice, and so there's like that piece of it too. So what I did here in Mendocino is I created kind of a general best practice documentation training based off of my experience, but also, again, like Patrick said, the pieces from the documentation toolkit, whether that be the BBS or CAMPed or different programs, and really tried to come up with something that was digestible with examples and some things for staff of different kind of levels and experiences and things like that. So that's what I'm going to kind of just go over. This is something that you are welcome to share on. I also not necessarily putting this out there because I know there are many people out there and MCOE is very small in rules, so I can't support every single person with this. But if you have questions, you can also email me or reach out to Capacity Grants and they can funnel that to get any questions that you have answered. And so I'm going to kind of walk you through some of the basics of what I do with that. So next page, please. So what I like to start with and explain to providers is that when it comes to documentation, hopefully in the school setting or wherever you're at, you are documenting already. If you're not, don't tell me. I'm going to cover my ears. We're going to leave that there. But best practice, right, is to document in some way. So one of the things that I like to just emphasize as I onboard different providers is that really is hopefully that your system has an EHR or an electronic health record where you can document and record the services that you're already providing. So one is to get familiar with that. Once you kind of are onboarded and familiar with whatever your EHR is really to look at what are the services depending on the program. Like I said, CYBHI is what I'm focused on. So I would look at CYBHI and say, what are the services that are eligible to be claimed and what am I already doing that can then be claimed for that? And so it's not doing anything new. I'm not saying that they have to add on more services. That's not what we're promising. What we're saying is we just really want to support providers in documenting what they're already doing. And a piece of that, hopefully, again, with our COABGI fee schedule, is that we have to gather the student insurance information, and then a consent to bill that insurance, and a consent to treat or consent for services. Again, every district is going to have a different example of what that looks like or how you gather that. But once you basically have what you need, that next step is to then record and document those services that you provided to the student or the family in the EHR or where it needs to go, and maintain that you have those authorization and consents in that. Next page, 2E. Okay, so I'm going to jump into some kind of best practices. Next page. So why is it important? I always really like to highlight, Patrick had shared already, but there, I think in terms of some best practice, whether that is true clinical, if you're a clinician or a licensed provider, or even non-clinical, that documentation is a core piece of our function and our roles, or should be, for best practice. And so there's a few reasons for that. One is it's client-centered. We want to make sure, again, we have that continuity of care, whether that's between providers who are all working on one particular student or case or whatever that might be, but also just making sure for our own continuity of care of like when we see so many students in a week, sometimes it can be helpful to go back to those notes if we write them and document them correctly to like know, what did we do in the last session? What is it that I said I needed to do to prep for another meeting with the student? What does that look like? So continuity of care is a really core piece of that. That also then informs our decision making around that student and goals, objectives, what we're going to be working on, what we need to do. It helps us to manage and have some progress monitoring and making sure that they're making progress. And if not, what do we need to do to pivot? And then at the end of the day, right, the goal is to improve those client care, student care, and outcomes for our students, our families, whoever it might be that we're working with. So then we jump over to that other piece, which is the legal and financial reason. So there's client-centered and really student-centered, and then there's the reasons that for legal reasons, for ethical reasons, for compliance reasons, that we need to make sure that we're documenting what we're doing, and making sure that we have certain things that go with that. Sometimes they're programmatic standards. It might be you need an MPI number on a claim, or you need to make sure you have the license number, or maybe you need to make sure, there's certain things that have content-wise that have to be in there. We want to make sure we're meeting the programmatic compliance regulatory pieces. That includes HIPAA, FERPA. We want to make sure that we have legal protections, but we're also protecting our students and the families that we serve. We want to make sure too that we know in our world audits happen, and different programs have different standards and things that they look at. And so really looking at, if you have good documentation, you can be pretty solid and confident that you're going to be covered regardless of what program you're billing under. And then again, billing and compliance accuracy to make sure that we get that funding back for the services we provided. Next slide. So what are some common types of documentation at school? I won't go too much into this. This is just more kind of common student records, right? Maybe those communication or service logs. You might have some behavior logs or support plans. Those might theoretically potentially be stored in a student information system. And then you might have other student records, which might be your medical, your health records. You might have your screenings, your questionnaires. You might have suspected child abuse reports that have to be documented or recorded in a certain way. And then you have more of your treatment, billing, or claiming related, which is usually stored in the electronic health record. Those might be your consents and authorizations. Those might also be your screenings, any evaluations that you do, any care plans or behavior support plans. And then really what most important too is those daily session and progress notes, depending on what your school or school district calls them. Next slide. So some general things for best practice is, one, keep it factual. We always want to make sure that we are factual. We're not making up things. We're not assuming things. I always tell my students, don't assume. It makes an ass out of you and me, and it just sticks with them. So we don't assume when we're writing documentation. You want to be really factual about what you're documenting and be really clear and concise. We don't need a novel. We don't need a whole paragraph. We don't need everything in the kitchen sink. We want to keep it really concise and concrete and to the point for a few reasons we'll highlight here in a second. And always make sure that it's dated and time tracked. Again, we see students throughout the week. We see families throughout the week. We want to make sure that, especially for claiming, that we're documenting all of those interactions. And it's also, again, going to protect us in the long run. Should something happen or come up, we have that documentation again to say this is kind of the flow of events that happen. And also, again, maintaining confidentiality and apply the minimum necessary rule. So what that means essentially is only put in what needs to be in a note. So I always just give the biggest example. Again, there's always smaller ones, but if let's say you have a student who discloses something, you don't have to put what they disclose. You don't have to add details. And most of the time, you don't really need to have that for multiple reasons. But you want to maintain their confidentiality. And going back to that quote that Patrick shared is really remembering that whatever you write, always kind of look at it with the frame of mind. If someone else is going to look at that, maybe someone else who doesn't know that student or child, maybe somebody else who doesn't have the context of what we're charting to or writing to. Maybe it's an auditor who has no clue of what we're doing and they're really checking for other things. We want to make sure that, again, we can keep our students confidential. So that, again, means avoiding names, ideally, if you can, making sure that you're not including other people into the chart right in the third person, refer to them as mother or father, unless you need to be more detailed. Just because, again, once you include that person's information, theoretically, that can then get pulled, that can get shared, maybe in court, that can get shared in other spaces because it's in that student's chart. So just making sure that we have that minimum necessary rule when documenting that. Use first person stigma free language. Instead of saying a person is, has or is schizophrenic, we would say they're struggling with schizophrenia, right? Like we want to make sure that we're looking at these humans as humans and people who have real issues and struggle with these things. They are not their diagnosis. They are not their clinical term of how we might describe them or how the school ed codes might describe them. We want to see them as a person first. And that also helps us with our documentation, but it also helps us to see the student as a student. Make sure you use professional but neutral language for behaviors or symptoms or goals. I know as a licensed marriage and family therapist, I can sometimes easily go into writing in a clinical way. And I have to remember that in the school setting, you don't have to do that all the time. You could, but I think it's best practice to keep it simple, short, again, to the point, and as non-clinical as possible. Practice concurrent note writing or documentation if you can. Again, I ebb and flow on this. This is always going to be up to your comfortability, but more importantly, the student's comfortability with this. In terms of writing a note during session, I always say I don't do it during session, but I'll do it right after or as soon as possible, just because, again, we might see that student multiple times in a week. We don't want those notes to get jumbled. We want to make sure that, again, we're documenting in the flow of what's happening. And again, if you're not able to do that, again, as soon as possible, hopefully within the week, but definitely generally before the next session. Next slide. So some common mistakes to avoid, they happen. We are also human, but we want to try as much as possible to avoid them, right? So the wrong student, wrong chart entry. This is common, right? We're going through a bunch of notes. We're trying to track them all. We write them down. So just making sure that we are charting to that student. I would add that if you are not super tech savvy, this might even look like having multiple browsers up and you have different students open in your EHR or whatever system you're using. I've had horror stories of notes that I'm writing for one student replace others just because of technology. So making sure that you have a system in place that works for you and that isn't going to include information from another student's chart into another. Incomplete documentation, so not having everything that you need to support what you're treating or supporting or supports that you do have. Under documenting also, as much as we want to be factual, clear, and concise and to the point, we also don't want to not document enough either. We want to make sure that we have enough to show what we're doing and what's needed. And then again, adding too much or too little information that might not be connected to the chart or what's needed. I always caution copy paste templates overload, meaning that we all have our own system. I have my own structure of a note in which I write, but really be making sure to be careful to not just paste the same exact thing every single time, right? You're not doing the same exact thing every single time with the student. You might be doing something similar, but charting to that particular day. Failing to sign or date or sign, those are really just simple things that we need to make sure we're doing. Vague or subjective or judgmental language, again, if we can stick back to professional language, you can avoid that. Backdating or altering the records, and I would add that we might do that sometimes, so making sure that you're notating that in your documentation if you do that, again, because that might be a huge audit red flag should they decide to audit you. Using improper abbreviations. I always say if you are going to abbreviate, spell it out first and put what the abbreviation is, and then you can abbreviate. But generally speaking, you have to remember, again, people who might be looking at the chart or auditing or reading aren't going to know what those abbreviations are. And we want to make sure that we can be very clear with that. And then just missed billing opportunities that we, again, are doing the work day in and day out with our students and families. get credit for it, right? And that's part of, again, where the documentation can come in to do that. Next slide. So some general progress note formatting examples. These are just some examples of what some best practices are across the different fields. Burp note, GURP note, SOAP, DAP. There's also others in between. And so I'm just going to kind of show some examples of what that might look like for that. Again, this is to give our COEs, or excuse me, our districts options in terms of what works for them. Next slide. So again, here's an example of a burp note. Again, we identify what the behavior is. Again, so it's avoiding that kind of clinical piece of it. We identify what our intervention is to address the behavior or what they were coming to see us for. We always include the student response, whether that is their overall engagement in that service, whether they stated something, whether they reacted to something. We want to make sure that we are documenting what that was. And then plan is pretty general, but it can be anything from their particular treatment plan. That might be the recommended next step of they need to get connected to a medical provider, or I need to follow up with mom or dad, or whoever that might be. We always want to, again, have a really clear plan of next step. And so there are some examples that you'll have access to. I'm not going to go over every single one, but that's the general structure of it. Next slide. Same thing with the GURP note. The kind of biggest difference is using that first section as a goal instead of the behavior. So if you have a goal that you are working on with a particular student, you can identify that that's what they're coming to you for. And then again, identifying what that intervention is, having the response that the student had to that particular intervention, or maybe their overall progress also towards that goal. And then the plan. What are those future sessions going to look like? And then any updates that need to happen. Next page. SOAP notes, these are probably familiar to any of the licensed professionals. This is what CAMPT, I know DHCS has also put this out there, and I believe that they got that from CAMPT as like a best practice. You can utilize this. This is totally fine, but this is also, again, probably generally going to be a more licensed provider who might utilize this. You might have some more subjective, whether, how did they come to session? What is your kind of subjective experience of why they're coming, what they're presenting as? You might have in there objective information, again, as like what did they actually present as, right? This might be their mental status exam, or this might be again, like what is it they are reporting versus our subjective experience of that. This might also include some interventions and the techniques that you used. And then the assessment, the A, is your analysis or the interpretation, whether that's of their progress overall, how they did in session. Maybe you have some interpretations or some impressions that you want to note, right? It's an assessment. This is also probably more subjective, but that could be where you could chart to that. And then the plan, again, same thing. If you had homework during sessions or any next steps that need to be identified, that would be where you capture it. Next one. And then the last one, again, is a DAP note. This is a really basic form. It's kind of a truncated, I guess, version of the other ones, which would be your data, which is, again, what you observed and what you did in session. This would be like the factual pieces of what you did and what you focused on. Your assessment is, again, to be your interpretation, again, your subjective analysis of how they did in that session, what they engaged in, maybe what you're thinking is going on with them. And then, again, plan. Any plan for future treatment, next steps, or who you need to connect with. Next page. So here's just some example that I share as some additional progress note, because sometimes it's like, wait, what does this look like if I'm, a student's positively engaged, or maybe they're anxious and avoidant, or they're low or depressed? What is that language that we can utilize? And maybe what are some common interventions that we could utilize? So these are just some examples that I share that kind of highlight those. Again, they're not all of it. They're just some examples of how to support staff with more of that professional language. Next page. And same thing, this is the same thing. So this is, again, to those different sections. This one is highlighting the response, assessing progress sections. Again, maybe they had some steady progress, limited, maybe they have an application of skills, maybe they gained some insight or they didn't. Those are just some language that you can utilize. And same with the plan, some different examples, if there was the follow-up that's needed, or there was homework that was given, or coordination that needed to happen. Those are just some examples that your teams could potentially use to meet the standards of those sections. Next page. And then Patrick had mentioned, kind of where this kind of started too, was that what we were finding when we kind of dug deeper into templates and examples is that there's not a ton of templates and examples for crisis notes outside of maybe like a safety plan or things like that, or notes that are outside of the specialty mental health realm or other programs. And so we were finding a hard time finding like something consistent. So I kind of pulled from a few different sources to kind of like combine and just get some best practices. So I think the biggest piece with crisis notes is they don't have to align to any goals or objectives or things that you're working on, generally speaking. Again, you're always going to want to check with your districts or your schools to see what their policies are. But you want to make sure that you're identifying what makes it distinct from a regular service note, right? You want to make sure that there's how does it deviate and makes it more of an actual true crisis, and identify what that is. Distinguish again, like why and what it was that they did. And importantly, if there are any interventions or ways to de-escalate that student, the severity of it, you're always going to want to chart to any plans or next steps or what you're doing to make sure that we are keeping that student safe. And again, continuing to assess for risk of harm. And again, is there a risk or is there not? Every school is a little bit different, but some schools, if there's no risk, then you always still document that. You don't necessarily not want to document it just because there's not a risk. You want to be clear that you assess for something and that you determine at that point in time there was no risk. But if there is a risk, you want to document. What did you do? Was there a safety plan that's needed? Did you connect them to a parent? Again, not just for the student safety and overall well-being, but also for liability reasons, that we want to be clear as to where does our liability start and end, and who did that go to after, again, whether it's a parent or somebody else. Next page. Oh, and that was it. So with that, that's what I would say is, though generally speaking, I know I went through that pretty quickly, but we tried to just do an overall, again, hitting kind of the main pieces. What I would encourage you to do, if it is something that you decide to share out with your schools or your districts or use as training, always make sure that you are including things that, again, are relevant from your school policies. That's the one thing that's probably not directly highlighted in the documentation toolkit. We mention it, but you're always going to want to go back and check your school policies because they might also have specific policies around documentation. So